In episode 22, my entrepreneur hero in the dental space, Emmet Scott, shares with us some of the struggles that people deal with when they're scaling their culture in the dental industry. I know one of the things that you've gotten really honed in on, and I know it's a hot button topic for everybody, is around culture, like and getting behind like the why you're doing this. And so you shared up front, you're doing this to help your friend, and that's how you look at it. And I love that mindset of from a DSO standpoint. But now you're knee deep in it, and you're seeing all these problems. So why do you continue to do it?
Well, let's hit on the culture piece for a minute. I think there's kind of extremes out there. There's those who think of culture as like nap times and bring your dog to work and all of those things. And then there's those who believe like, culture's crap and, just get your job done.
Mm-hmm.
I think at the essence, we have to know that as strategic as we try to be around locations and patients and treatment coordination and so forth, the entire infrastructure of dental and many other businesses are just a bunch of humans working together, right? To get to an outcome. We don't necessarily have like a special software like Facebook, right? That's running algorithms and helping us generate income. You could argue even in those businesses, it's a bunch of humans who have to do the programming and everything else. But especially in healthcare, the culture is really the operating system by which all of us know how to behave, especially when the boss isn't there anymore. I think for most people, the reason they don't have to worry about culture is if you've got a big personality and your entire operation is in four walls, when you show up every day, you're setting the culture.
Yeah.
Right. Everyone, okay, Dr. Emmett's coming in, right? And this is, he's in a good mood. Okay, great. We're going to behave like he's in a bad mood. Everyone knows how to behave around that. That kind of is defining the culture. When you get into scaling and you're in multiple locations and you can't influence that, you have to be very proactive about who are we? Why are we doing what we're doing so that people know how to show up every day and how to behave with one another. And think about, just from a therapy perspective, how many everyone just came out of Thanksgiving, right? It was like, all these, and that's your own family coming together. Think of all these multiple families all in a practice with, how they think being friendly is in their family versus this one thinks being friendly is.
Or being friendly in California versus being friendly in New Jersey. You know what I mean?
Exactly. So how do you bring that all together? I think that's why culture and focusing on it is so important. And if you're not focused on it, you still have one, right? It's not like culture just goes away. It's just you're not controlling it proactively.
So one of the key words you said is why we're doing this, right? Like what's the why behind what we're doing? Do you guys rally around that as a culture, or what do you rally around? How are you rallying?
Yeah, we're revolutionizing dental care by taking care of underserved patients and creating an amazing doctor, staff, and patient experience. So for us, really rallying around the underserved markets is important to us. I think if I was giving someone some advice, maybe a couple resources to go create culture would be Patrick Lencioni's book, The Advantage. He's got like 6 questions. And what I really like is he's not big into vision mission statements. He just says, just create a mantra that everyone can remember and utilize. And now every department's created a mantra under our umbrella mantra. I think his questionnaire, his 6 questions, super simple, quick way to get there and say, okay, why do we exist? Who are we trying to serve? What's the impact we want to have? And just make sure that can't be misunderstood.
Dr. Nacho himself shared how not everybody likes him. You're going to be shocked at what he says on this one.
There's a current movie that's wonderful called Encanto. We've watched it 10 times. It is written by the world treasure Lin-Manuel Miranda. He's also the one who has written Hamilton. If you read the reviews of those movies, someone does not like them. Most people do, some don't. I put those in the notches. So for a reverse thing, do not overvalue, it's a Gary Vee thing, small bits of negative criticism, because it's impossible for everyone to like you, and you wouldn't want them to. If we're eating a plate of nachos, and Gary, I say these are great, and you think they're spicy, same nachos, I like them, you don't. Now, if you consistently get feedback about a problem, the manager at your office is rude,
or the chips are soggy or
rough,
whatever.
the chips are soggy, dig into it, to use a Nacho thing, and see what you can fix before you fire, right? People are talking about firing all the time. I can barely get people to work with me. But I try to work, like I have this E-Myth Revisited book near me at all times, and I have the Checklist Manifesto. And right in the E-Myth Revisited, it talks about get sort of the least trained people possible to work with you productively, not in a mean way, but like if I had to show up at your organization tomorrow, Gary, and people are like, Paul doesn't freaking know anything about Facebook ads, it'd be like, but he's working here. Let's get him competent. So I try to say, hey, if we get feedback, let's see what we can fix before we fire. And that's what I strive to do with my team, make them feel supported, make them feel like I have their back, but also be willing to have friendly, uncomfortable conversations. You know, someone gets seated 5 minutes late for their crown. It's not as big a deal as if our sterilizer's not working right. That's an enormous deal. Yeah. I think a lot of leaders don't prioritize their intensity. And by intensity, means stress. I think a lot of times they make their team feel just as mad as if there's a Post-it on the floor as if they forgot to get an implant for a case. I think that's why their team gets confused, and I strive not to do that with mine.